As a research nurse based in the emergency department, we often recruit patients onto research trials and research studies, often using point-of-care testing devices.
One of the recent studies that we've been carrying out is on patients that attend the emergency department with chest pain, testing 2 different types of devices to determine whether that patient has had a heart attack in a shorter amount of time. Basically, the patient's bloods are taken when they arrive in the department, they're analysed on this machine, and within 10 to 15 minutes we can find out whether that patient has got raised enzymes which will determine whether or not they've had a heart attack.
And this is a simple bedside test, and it's used with basically a prick of blood from the finger, and that gives us a result instantly of positive or negative. The HDFT is a protein that's released by the heart if you've perhaps had a heart attack, and that is sensitive within 30 minutes of onset of chest pain. Currently we send bloods off to the lab to look for troponin results, and that takes around about an hour, and the peak of that is at 3 to 6 hours, so often people have to be admitted for repeat troponin tests. So this is something that a GP could use in their surgery that would give them an instant result. This is something that the ambulance service that they can use and give them an instant result. It's something we can use in the emergency department and will possibly stop people being admitted to hospital for repeat tests, so freeing up hospital beds.
You're able to treat a patient quicker on those results rather than waiting an hour for results to come back from the laboratory.
So patient care and their experience, you know, is a quality one.
Patients when they come in with chest pain. It's really important to us as a research team to know that the patients that we're recruiting to studies have enjoyed their experience and found it beneficial to them. Sending out feedback questionnaires to patients means that we can get that feedback from people and find out how we can improve our practice for the future. Part of quite a lot of our research studies involve following up patients, whether that's 30 days later, 60 days later, 2 years, 10 years later. This is so that we can gauge where that patient is at that time and whether the research has affected them.
Today we'll be doing a 2-year follow-up visit. The BEEP research study stands for Barrier Enhancement and Eczema Prevention, and it's looking at preventing eczema in newborn babies that have a family history of eczema, asthma or hay fever.
We decided to take part in the trial because my partner suffers with eczema. He suffered quite badly as a child, so anything to help. The risks would be explained to you if there are any, so you shouldn't have any fears about taking part in trials.
I like to be involved in improving care generally for patients within the NHS. I love the sort of flexible way of working and the variety that research brings within the role.